Nursing is an ever-changing and diversified field. With this, student nurses need to gain the proper knowledge, skills, and attitude throughout their academic journey to become well-rounded and flexible nursing professionals. Good day, everyone. We are the researchers from BSN 3A Group 2B. I am Riana Lacson, and together with me are Hyacinth Lamio, Locsin, and Daisyree to present our research study entitled Self-Assessment of the Learning Domains with Bloom's Taxonomy Among Nursing Students. Bloom's taxonomy comprises 3 learning domains, namely cognitive, affective, and psychomotor, that are classified according to their precision and difficulty. We wanted to know the proficiency levels in various learning domains among nursing students. This study covers more about the nursing student skills in applying things learned in a classroom setting to a clinical or hospital setting. For the purpose of the study aims to determine the self-assessment of learning domains with Bloom's taxonomy among nursing students. The specific inquiries that the study seeks to answer are as follows. First, what is the demographic profile of the nursing students when grouped according to sex, year level, and GWA? Second, what is the self-assessment of learning domains with Bloom's taxonomy among nursing students in terms of cognitive, affective, and psychomotor? Third, is there a significant relationship in the self-assessment of learning among nursing students in terms of cognitive, affective, and psychomotor domains and the following profile variables: sex, year level, and GWA? Lastly, is there a significant difference in the self-assessment of learning domains with Bloom's taxonomy among nursing students as a whole and in terms of cognitive, affective, and psychomotor domains when grouped according to the following demographic profile: sex, year level, and GWA?
For research design, descriptive quantitative research was utilized to measure the nursing students' self-assessment on their level of knowledge, skills, and attitudes based on the learning domains of Bloom's taxonomy. It focused more on the quantity of responses and emphasized collecting structured and close-ended data, utilizing questions with no open-ended, lengthy responses. Likewise, the researchers gather the data through the use of a survey method as it collects quantifiable information that can be compared across different populations. For the participants, the study involved the year levels 2, 3, and 4 nursing students enrolled in the Bachelor of Science in Nursing for the second semester of academic year 2023-2024. Sloven's formula was used to calculate the sample size of 249 students out of the total population of 666. Through the probability stratified random sampling technique, the population was divided into subgroups before sampling was done. With the sub-sample size determined, the study used simple random sampling, specifically the drawing of lots to select the sample from each section at every year level. Moving on to the instrument, the study utilized a researcher-made survey questionnaire. This was developed to collect data pertaining to the study's specific research objectives. The survey questionnaire was composed of 2 parts. Part 1 consisted of the demographic profile of the participants, and Part 2 consisted of the questionnaire proper. For the validity, the survey questionnaire was validated using Gooden skates by 3 experts who have experience in the field with a mean score of 4.87. For reliability, the study utilized Cronbach's alpha with a mean score of 0.880.
Moving on to the results and discussion, for the demographic profile of the nursing students, the majority of the participants belong to the female category at 79.1%, while 20.9% were male nursing students. The majority of the participants were 4th-year nursing students at 40.2%, and lastly, the majority of the participants have a GWA of very good at 69.9%. Now let us proceed to the level of self-assessment of the learning domains with Bloom's taxonomy among nursing students. Nursing students scored a value of 3.44 in the cognitive domain, indicating a varied satisfaction levels. Enhancing nursing students in cognitive skills could be beneficial. Secondly, nursing students scored a value of 4.09 in the affective domain, indicating a high level of openness, engagement, motivation, attentiveness, and confidence in their learning environment. Lastly, in the psychomotor domain, presents a mean value of 3.81. This entails that nursing students perceive themselves as high proficient in psychomotor domain.
For the relationship between the level of cognitive learning domain and profile variables, there is no significant relationship between the level of cognitive skills of the participants and the profile variables. This indicates that sex, year level, and GWA were not indicators of the participants' level of cognitive domain. Moving forward to the relationship between the level of affective learning domain and profile variables, there is a weak significant relationship between the level of affective domain of the participants and its profile variables, which implies that both sex and year level may not be indicators of their level of affective domain. However, there is no significant relationship between the level of affective skills and GWA, which indicates that GWA is not an indicator of their level of affective domain. Lastly, for the relationship between the level of psychomotor learning domain and profile variables, there is no significant relationship between the level of psychomotor skills of the participants and the profile variables. The results indicate that the participants' degree of psychomotor skills is not significantly related to sex, year level, and GWA. For the difference in the self-assessment of cognitive learning domain when grouped according to profile variables, there is no significant difference in the level of cognitive learning domains of the nursing students when grouped according to profile variables. The results indicate that the nursing students' level of cognitive learning domains is statistically the same when grouped by sex, year level, and GWA. For the difference in the self-assessment of affective learning domain when grouped according to profile variables, there is no significant difference in the level of affective learning domains of the nursing students when grouped according to GWA, which implies that the level of affective ability is statistically the same when grouped by GWA. However, there is a significant difference in the level of affective learning domains when grouped according to sex and year level. This implies that female nursing students and those in the higher year levels show a significant difference in the affective learning domains. For the level of affective learning domain when grouped according to year level. For the first pair, there is no significant difference in the level of affective domain of second year and third year nursing students. For the second pair, there is no significant difference in the level of affective domain of second year and fourth year nursing students. Both results indicate that the affective level of second year nursing students is statistically equivalent to that of third year and fourth year nursing students. This implies that academic progression of students may not correlate with this particular domain. However, there is a significant difference in the level of affective domain between third year and fourth year nursing students, indicating that third year nursing students are higher in the affective domain. It may suggest a potential variation in their development of affective skills. Moving forward to self-assessment of psychomotor learning domain according to profile variables. There is no significant difference in the level of psychomotor learning domains of the nursing students when grouped according to profile variables. The results indicate that the students' level of psychomotor learning domains is statistically the same when the nursing students are grouped by sex, year level, and GWA.
For the conclusion, nursing students demonstrate moderate proficiency in the cognitive domain, whereas high proficiency was noted in both the affective and psychomotor domains. There is a weak significant relationship in the affective domain for sex and year level. When grouped according to demographic profile, there are no statistically significant difference in sex, year level, or GWA in the cognitive and psychomotor domains. On the other hand, results in the affective domain show contrasting trends when considering the variables sex and year level. Female scores higher than males, and third year scores higher than fourth year.
For the recommendation, for the nursing service administrator can use this study to enhance nursing students' learning in cognitive, affective, and psychomotor domains. For the nursing educators can refine the teaching approaches and interventions based on the study, addressing specific learning needs in nursing students. Nursing students can gain insights into self-assessment and learning perception, understanding strengths and areas for improvement. And lastly, for future researchers, can build upon the study to explore factors affecting nursing students' self-assessment and the outcomes of targeted interventions in nursing education. With that, we have come to the end of our presentation for our research study, Self-Assessment of Learning Domains with Bloom's Taxonomy among Nursing Students. Have a great day and thank you for listening.